So here we are in Warsaw. We're at the Joint Preservation Congress of Konrad Słonowski, and what really attracted myself and the Regenerative team to come here for this brilliant 3-day meeting was partly to speak. I've been asked to speak about ACL repair and also osteotomy surgery, but really a big focus of this meeting is all about regenerative medicine. And actually, one of the key players in this field currently at the moment globally is Professor Carlo Tremolada from Milan. And it's great to have the opportunity to speak to Carlo about his amazing invention, lipogems. So Carlo, how long have you been using lipogems? Tell us a little bit about the history.
Well, the history of lipogems is back to before 2010. It was not really lipogems, it was an attempt to have a better fat grafting. I was not looking really for having something that revolutionized regenerative medicine, as it turned out to be.
Because you're primarily a plastic surgeon.
I am primarily a plastic surgeon, a maxillofacial surgeon, and I was looking for a better way to do fat grafting that is a common procedure in our specialty, like bone grafting for you, and with the idea of having very little pieces of this fat that maintains the functionality of the functional unit, the niche of the adipose tissue. And now we know, thanks also to Arnold Kaplan, that the fat tissue has a lot of microvasculature, and this microvasculature is full of cells that are called pericytes, that are the precursor of mesenchymal stem cell in the natural healing trauma response.
So lipogems itself is not a stem cell product, is it?
Yes, it's not a stem cell product, it's a tissue that is processed by mechanical forces, preserving the structural integrity of the fat. That's why also FDA has approved it as a surgical product that can be used immediately.
This is in the United States, isn't it?
This is in the United States. In Europe, it's used as a fat grafting procedure without any problem.
So, Carlo, when you were initially using fat, was it for rejuvenation or was it as a filler, as a plastic surgeon?
The idea was to use as a filler, but very soon we realized that he had incredible, amazing regenerative properties. And I went to ask to scientists, especially in the United States, but also in Europe. I am collaborating with Pasteur Institute, Professor Tremolada. I'm collaborating in Edinburgh, in UK, with Professor Peolt and other scientists, and now in Manchester. And I asked, what is happening here? Why I have so good results, especially in irradiated patient? And it came out that this processing, that is a special processing to wash away all the inflammatory part of the fat and reducing it to little pieces, just start the regenerative normal physiologic procedure. And
so what you're doing with the fat, with lipogems, is you're washing away the blood, washing away the oil, fragmenting it within the cocktail shaker that you've invented, and cleaning it to the point where you have very, very clean, micro-fragmented fat. Is that correct?
It's exactly correct. We have very little pieces. It's about 500 microns. It came out to be a very, it's like a creamy substance, but is made of little intact particles of fat. And this works as a graft, engrafting perfectly in the tissue, enhancing the vascularity, and working as for many months, for a sustained regeneration.
So tell us more about these pericytes. So within the vasculature, within the fat, lining the blood vessels are these small cells, pericytes. Why are they important?
This was a merit of your connational Bruno Peolt that discovered that these pericytes are the origin of all mesenchymal stem cells. These pericytes stabilize the little blood vessels, so are important in a lot of other functions.
You have them everywhere in your body.
Everywhere, every capillaries. That's why there are a lot of publications every month coming out. We have found stem cell in the teeth, of course. We have found all stem cells come from these pericytes.
And the mesenchymal stem cells come from the pericytes within the fat.
Within any tissue, the pericytes are the precursor of this mesenchymal stem cell.
Free stem cells.
Yes, and this is the natural way. Is a trauma on the microvasculature, and the pericytes detached from the vasculature and became naturally mesenchymal stem cell. Our technology, I've used enzymes to isolate these pericytes and cultivate them in mesenchymal stem cell. We obtain billions of mesenchymal stem cells, but in a certain way they are not as good as the natural ones because they don't know what to do.
So this minimally manipulated technique gives you better stem cells?
Not only is very safe to use, but also give better stem cells.
And in terms of the action of lipogems, how do you think it really works for, say, arthritis? If you inject it into a painful joint, what do you think really happens?
It happens that the little particles engraft in the tissues, especially in the synovium, that is the tissue that drives the regeneration of cartilage, of tendons, of all the tissue around the joint, and help the natural, the stem cells that are already there to work better. So it's like a director of work, and that is the good thing.
Conductor within
like a conductor in English. Sorry for my English.
No, that's right. That's right. So, and you say it's a sustained effect, so it doesn't just happen for over a week.
We have seen in other applications where we have seen also histologically. For example, it works very well in postmenopausal women with sex problem in vagina with dryness, and it can be completely reversed. We are publishing this in Menopause very soon. The mucosa is completely reversing in 3 years. So at 3 years you have better mucosa than at 1 year after the procedure. So we have continuous improvement.
So what do you think are the main indications for it now? Obviously, orthopedics is number one. It's painful joints. It's arthritis. Mm-hmm. What are the other indications? 'Cause I know you've done a lot of work with radiotherapy and with skin that's been compromised from infection and so on.
The indication, if you think about mesenchymal stem cell biology, and you have to go back to the thousands of publications about mesenchymal stem cell, you have to see lipogems as a very effective way to deliver naturally this stem cell to where they are needed for a long time. So the applications are really a lot, too much perhaps.
So you're using it to treat diabetic ulcers.
I use them whenever it's necessary to have a difficult regeneration.
Right.
For example,
for
healing. All people benefit a lot from this. Diseased people benefit a lot of this technology. Of course, young athletes will speed up a little the healing, but will heal anyway.
And
this is important in sport medicine,
and
of course.
This isn't a new therapy. How many cases have been done so far?
Have been done around the world now more than 20,000 cases. Right. So we have seen, and we have not seen a single complication. Real complication.
So no complications?
Zero. It's super safe.
So just some bruising maybe from...
Yes, for the fat harvesting, that is not a liposuction. It's less invasive, but you can have some bruising, but that is not a complication. That is a normal surgical...
And in terms of why we haven't seen any infection when we inject it into joints, can you explain that to us?
That is incredibly interesting because not only injecting to joints, but for example, in diabetic foot is injected into an infected area and it clears the infection. Right. And a recent work of Pasteur Institute has demonstrated that also help treating sepsis, for example. It will be published soon in British Journal of Anesthesiology. Treats
infection because it has antibiotic properties?
Is that both antibiotic property because it creates a peptide that is called LL37 that kills bacteria on contact. Right. And this peptide we found in our saliva, for example. It's the first line of defense for our gastrointestinal tract. Right. So it just amplifies any kind of defense we have in our body.
And how many
That's why it's so safe.
How many growth factors have you identified that have been secreted by the stem cells, by the mesenchymal stem cells, once they get going?
There are more than 900 growth factors. And there is a huge work now in different research centers in identifying the different growth factors between lipogen's product, classical mesenchymal stem cell obtained, for example, by enzymatic processing.
So that's manipulated stem cells.
Manipulated, sure. But still they are the most studied up to now. Yeah. and also normal lipoaspirate. And it has been seen that lipogems has a proteomic array that is really different and peculiar and targeted to the each problem that he finds in the disease tissue. That is extremely interesting. It's still an ongoing research, but it's from this research that we will understand all the mechanisms at the basis of this reaction.
And if we go back to how it actually works, we've talked about the cytokine effect,
Yeah.
And you get this initial response that's very favourable to the joint. Tell us about that. How does that work? How do you get this pain-free period following a lipogems injection in that first few hours?
Yeah, that's very strange because I have at the beginning we call it the magic because it really seems unbelievable that for the first few hours you have no pain or swelling, zero. Is because when you process the lipoaspirate, you have, in a certain sense, activate this mini fragment of intact adipose tissue, and they begin to secrete immediately a lot of anti-inflammatory cytokines that also bind to the pain receptors.
It's the mu receptor, isn't it? It's the
yes,
same one the morphine binds to.
And very similar. And this brings down the perception of pain and the perception and the inflammation, basically. This is not, I say also to the patient, this is not long-standing. You will have a period of up to also 1 to 3 months in which you don't understand really what is happening. Nothing bad, but nothing particularly striking
good. But it can take up to 3 months before you...
Yes, and then it will improve a lot. It will continue to improve for up to 2 years with a single injection or with a single application.
And in terms of the story of lipogems, you won this award in the USA. It was last year, wasn't it, when you were awarded the Innovation Prize?
Yes, it was awarded Lipogems, not myself.
But I mean, it's your creation, Carlo.
Yeah.
So.
Lipogems was awarded as the best sport medicine technology in 2016
so the innovation
by the American Association of Orthopedic Surgeons.
Wow.
It was a panel of 10 top orthopedic surgeons like Andrews, like Brian Cole, that choose lipogems.
So centers of excellence now in the US, they're using this technology?
Of course. It's used by Brian Cole at Rush University. They are still is used at Andrews Institute, is used in New York, is used almost everywhere in the United States and 27 other countries around the world. And what is interesting is became like a gold standard for high-level sport medicine for equine. UK, for example, is very well known for having treated the top polo horses. And there are various articles on Polo Times, you can Google it, in which demonstrates that lipogems is extremely useful for polo injuries. So it may be that lipogems can also a role in acute sport medicine injury.
And where do you think the future is for lipogems? Do you see it obviously it's becoming a much more popular treatment?
I hope so, and I think so. But I also believe that this is just the tip of the iceberg, and we need a big effort from all of the specialists in different, in orthopedics or in different specialities, to get the best from this technology, because we have to remember this is a good way to release mesenchymal stem cell in our body.
You talk about a bioreactor.
It's like a bioreactor containing the scaffold, which is the structure of the adipose tissue, containing the cells, which is these pericytes that transform spontaneously in mesenchymal stem cell, and begin to secrete a lot of targeted cytokines. Cytokines are like drugs. So it's like a personalized drugstores that help you heal for many months.
And just to get a link between yourself and Professor Kaplan, he's obviously the most famous scientist in the world at the moment. He's the father of the mesenchymal stem cell. How did he become interested in lipogems? What was the story there?
The story was very interesting. It was presented to me by a common friend and co-founder in lipogems, that is Professor Camillo Ricordi in Miami University. And after a while, he was impressed by he analyzed, of course, the product. He was impressed by the fact that immediately say this is the perfect way to deliver the mesenchymal stem cell. He had lipogems on himself and on his member on his family, very successful.
What was that for? Why did Professor Kaplan have?
I can say because he says on a YouTube testimonial.
Video, that's right, yeah.
He had problem of with a
hip,
with a
wasn't it?
hip
That's right.
full of scar, and the scar faded with. And
So he had a hip replacement. It was painful.
Yes.
He had it injected, and it cured him.
And it cured him. And his wife was cured for his knee and his ankle, with very good outcome. Of course, the knee was a little too advanced, so I know that after 4 years, but she was scheduled to have it immediately, she had a knee replacement. But the ankle is still perfect.
Brilliant. Well, listen, thank you very much, Carlo, the founder of the idea of lipogems. Brilliant to have interviewed you.
Thank you very much.